Dressings are to be changed every 7 days and as necessary when wet, loose, or soiled, utilizing a standard central line dressing kit. This is because the size of the device is larger than a traditional IV and requires a larger dressing. Using clean technique, remove the occlusive dressing. Using aseptic technique, don sterile gloves and remove the disc or gel patch, and after swabbing with alcohol at the wings, remove the stat lock device. Cleanse the site with chlorhexidine impregnated swabs and let dry. Use skin prep and reapply the stat lock device. Place a disc or gel patch and then place an occlusive dressing over the insertion site, covering both the site and the disc. Place a sticker with the type of device, date, time, and initials on the dressing, and then document the procedure in the electronic chart. Every 12 hours, the midline catheter site should be assessed for patency, redness, irritation, and/or discomfort to the patient. Flushing and assessment for blood return should be performed and documented. Removal should be performed when therapy is completed unless otherwise indicated. Midline catheters should be removed if swelling, redness, irritation, or complaint of patient discomfort occurs. Before you attempt to remove the line, you need to know how long the line is. At our facility, this information can be found under the Mini Assessment Midline Insertion section in ClinDoc. You should gently remove the dressing and the stat lock device from the site using clean technique. Be sure to gently remove the catheter and observe that the catheter is intact. Use manual pressure to assure hemostasis has been obtained. Place a gauze dressing to the site and then document the procedure in the electronic chart. If the line is clotted with blood due to improper maintenance, you can administer 2 mg of CathFlow IV push to the midline in an effort to dissolve blood in the line. Do not forward flush with saline. Only let the CathFlow dwell in the line, then try to aspirate it. If unable to aspirate with a 3 ml syringe, have the line removed or contact the vascular access team. In terms of monitoring, the vascular access team has and will be recording all relevant line placement data. In regards to midlines, we are recording how many attempts, successful placements, failed placements, and how many each member of the team is doing per month. Additionally, we are now recording improper orders leading to delays in treatment, improper callouts, and traditional IV starts that are requested by staff. If you request an IV be started by the vascular access team, they will inquire into how many times you have attempted the line, if a midline may be warranted, and the status of the patient. If they place this traditional IV for you and have determined that you have not made an effort to place a line despite saying otherwise, they have been instructed to report your name to your manager and to float time to your department. Thank you for watching. If you enjoyed this content, consider liking the video. Leave us feedback in the form of a comment if you have any questions, concerns, complaints, or compliments. If you want to see more content like this, consider subscribing to see more footage like this. Till next time, stay safe.